Well, the first World Health Organization focusing on improving healthcare in Africa has wrapped up in the Rwandan capital, Kigali. Through the summit, delegates from the healthcare, finance and private sectors have formed several partnerships that will help boost healthcare services on the continent. Hlonela Lupuwana caught up with the regional director for the World Health Organization in Africa to talk about the challenges within the industry that have led to this forum.
I think, just put briefly, what we can say is that African countries, most African countries, are not able to provide basic health services for all their populations, and particularly basic health services of good quality. And there are several reasons for this. One is that financing for health is not sufficient. So there is simply not enough money going into the health systems to pay for a variety of critical needs. And then secondly, the financing needs to be targeted in ways that make the best use of what money countries have to get the best results in terms of improved health outcomes. So we have what the experts call allocative inefficiencies, meaning even if we speak a lot about primary health care and prevention, in the end, quite a sizable percentage of health budgets goes into hospitals, and particularly big central hospitals, thus leaving people where they live, either in the periphery, in rural areas especially, and even in peri-urban areas in the city, not sufficiently covered with services.
You mentioned financing, and a lot of this money comes from donors from abroad as well as locally, not just government. How do you balance out the control that they have once they've donated? We
have a certain distortion, I would say, and even a certain replacement of domestic funding by some of these big initiatives of funding specific diseases, which were set up with very good intentions because we had very tragic situations. So I think we need also a way of managing the funding, aligning it with priorities. If it was possible to pool it, that would be best. Then you could get money for HIV, for immunization, supporting the system that's going to deliver, and therefore going a longer way to deliver for other diseases, I think. The other thing that we have, if we have very many donors working in a not very well coordinated way, is to impose a heavy burden on the governments to work with them. If the reporting needs to be individually targeted, instead of having one report on the health sector, which then enables all the contributors to see what their contribution have done, for example.
Lastly, we've had several outbreaks within the Africa region, cholera, malaria, Ebola, quite recently. What lessons have we learned from those outbreaks? What are we doing differently?
I think one of the big lessons that we've learned is precisely that if you have a health system that is so weak that a disease can start to spread in a corner of your country somewhere and you can be not aware, and therefore we put in place preparedness mechanisms in line with what we call the international health regulations in W.H.O, because our interest is to stop or prevent the international spread of disease, and countries have signed on to a global treaty almost of being responsible. Of course, we expect governments to also care about their citizens, so you don't want disease spreading internally as well. So we've learned that preparedness is very important, a stronger health system is very important, including with financing, and we learned also that engaging communities is very important. So you build the resilience from the household level.